Hello again, good evening. We're back again with RevitaLive with Kiru today evening. Today is the 24th of March and day 7 of our current movement restriction order. So I'm sure a lot of our viewers will be quite bored at home, and it's lucky that we have this form of engagement where we can actually speak to you all and share some wisdom, some information regarding a topic that we discuss every week. And today we are quite lucky to have my very lovely guest, consultant chest physician Dr. Ong Choo Khoon from Gleneagles Penang, and she's very kindly agreed to be with us today to share her knowledge and information on obesity and related diseases with respiratory conditions. So, Dr. Ong, good evening.
Dr. Ong here. Yes.
So, as you can see, Dr. Ong and myself, we are maintaining our social distancing. We have to be like 1 meter apart, right?
Yes.
1 meter apart. And I think we are ready to probably discuss on today's topic, Dr. Ong. So, perhaps, I think as we know, obesity is I think a rampant problem. I think we keep speaking about it every week. From your opinion, what's the effects of obesity to the respiratory system?
I think as we already readily know, obesity is actually one of the major public health concern. Obesity is linked to a lot of chronic illnesses, namely metabolic condition like diabetes, hypertension, stroke. Of course, as a chest physician, we are seeing patients with obstructive sleep apnea, even asthma. There are some association with obesity. People who are obese or overweight, they're actually having higher prevalence of asthma or respiratory related illnesses.
Okay. So, in terms of like obstructive sleep apnea, how does a patient present with sleep apnea?
Okay. Obstructive sleep apnea, what we normally use the short term of OSA, is a condition where the patient has actually this stop of breathing during sleep. We can have this pause of breathing in a very short period of time. That's normal. But if it is excessive, then it is pathological, and it will actually lead to a lot of health consequences. Patient with sleep apnea, I think one of the common symptoms that a patient will come to you is snoring. Not all snorers are sleep apnea patients, but snoring is one of the common symptoms that the patient will come to us. The other major important symptoms would be daytime sleepiness. A lot of time, because of unrestored sleep, they don't get enough good sleep. Although literally they are sleeping like 6 to 7 hours at night, but they are not getting a good night's sleep. OSA only happens during sleep. So when one sleep, our muscles are in a relaxed condition. So your tongue, uvula, and all the soft tissue will actually fall backward, and it obstructs the airway. So if this happens, repetitively, so it would actually lead to oxygen deprivation. So your body would actually, some sense of sort of like alarm you that you wake up from sleep. So people with sleep apnea, they will actually feel, as if they feel choking, or gasping. So these are the symptoms of sleep apnea.
So I think the problem with that probably you don't have a good night's sleep, especially if you're going to work the next day, and then in this situation probably you'll remain tired and so on. I think I had one patient who actually suffered from an accident, because of poor night's sleep, and he actually fell asleep while he was on his motorbike and sustained was involved in an MVA and had to be brought in with a leg fracture. And of course, he was obese with a BMI of about 40. So I can understand how the situation will be, and sometimes it can be life-threatening also, especially if you get involved in an accident and all that. Maybe that's why quite a number of vehicles suddenly will just lose control and probably hit a barrier or something on the highway, and these are the issues. So how can someone who is either obese or non-obese as well, how will they be able to know whether they're actually suffering from sleep apnea or its related conditions due to obesity?
Okay. OSA, this is actually quite common. I would say in general populations, about 4% of populations are mainly male patients are affected. And mind you, I mean, OSA that we see in this part of the world may be slightly different, from the OSA that we see in the Western countries. For example, here, even sometimes the patients are not really obese, but they may actually have some symptoms of OSA. But let's go back to the topics of this OSA with obesity. So the common symptoms, like I have alluded earlier on, daytime sleepiness, tiredness, depends on the work you are doing. Some people may find that their memory are not as good. They cannot concentrate much during work, especially if you are doing, office work in a meeting or on a wheel, things like this, so these are the symptoms that brought the patient to us. Of course, there are some patients who are found to have OSA as a consequence of other problems. For example, people coming in with MVA and found out to be apnea, or during the operation, they found out that this patient had apneic episodes, or uncontrolled hypertension, or patients who go to the cardiologist with heart failure symptoms. So these are some of the common manifestation of people with OSA. So when we are dealing with people like this, we have to think about OSA as one of the differentials.
Is there any simple tools that our viewers can use to actually know whether they're actually suffering from OSA or conditions?
First, when we see a patient, we assess their risk factors. Of course, there are a lot of questionnaires that you can actually go through to see whether you have the risk factors. One of it, I think, which is quite good. There are many actually. Some we do this in a research, but there's one that we were going to share later on. Stop Bank questionnaire. It's one of the screening tools. It's not to diagnose OSA, but it's sort of for you to go through whether you actually have the risk factor. STOPS, STOPBANG. S stands for snoring. T for I'm going to show you this one here. I'm not sure whether you can see it here.
Yeah, we'll have it available in our...
T for tiredness. Okay. Do you often feel tired? Do you sleep during the daytime? O for observed apnea. This one is usually your bed partner or your friends. Really observe that you actually have a witness apnea. When you sleep, they literally, they can see you stop breathing for a while and then regain the breathing. Pressure refers to high blood pressure. BMI, the body mass index of more than 35, or even in Asian population like Dr. Kiru. We're taking this lower than that, right? Age over 50, neck circumference, people with short neck. In gender, of course, like I said earlier on, male more commonly going to have OSA. So this is a simple questionnaire that one can go through. If you have three positive response from this, that means you might have OSA, then you should consider, come forward to actually do the screening. To diagnose OSA, we need to do a sleep study, or what we call polysomnography. So it is a test that you can do it in the hospital, in the sleep lab, or more commonly we're doing now as a home-based testing.
Oh, I see. Okay.
Yes.
So patients can actually go back home, have a good night's sleep, and actually do a sleep test and see whether you are having sleep apnea or any risks to develop the syndrome, right?
Yes.
Okay, if let's say we are actually putting up this very simple Stop Bank scoring system, we will actually share it in our Facebook page later on. So please feel free to actually access it. You can score yourself and check out. And if you answer 3 or more positive answers to these questions, then how should the patients or the public proceed?
Sleep medicine is actually a very broad thing, but we're talking about OSA, the specialty that sees and managing sleep apnea are chest physician, and some of our ENT colleagues are also managing the illness. So you can come forward to us and then to seek consultation and moving on from there.
Okay. Right. Coming to other respiratory disorders, Ong, can you perhaps tell the viewers generally on another common symptom that most of them will suffer, especially on a rainy day or due to the weather, simple condition like a bronchial asthma?
Okay, asthma is a common respiratory condition that we see, in our day-to-day practice. When we talk about particularly obesity and asthma, what we know is asthma patients who are obese, they tend to have more respiratory symptoms, okay, more uncontrolled condition compared to the non-obese population. So obesity, in short, is one of the risk factors that we need to look at. When we have patients who come to you with uncontrolled asthma, besides looking at the common factors, that leads to uncontrolled symptoms like compliance is one of it, whether they are using the technique of using the inhaler is correct or not. One of the things that one shouldn't forget is whether, the body weight and all this is one of the things that you should look at. I'm not saying that obesity is contribute, solely to the control, but there are more and more evidence to show that people who are obese or overweight, the asthma prevalence are higher. That is actually related to the adipose tissues, all these adipokines in the body that actually affects directly on our airway.
Yes.
That leads to the asthma symptoms. Besides what we readily know about asthmatic allergic component.
Correct.
Yeah.
Okay. Actually, we have some Facebook viewers looking at us. Hi Min, hi Eileen, hi Jasmine, and hi Izo. Nice having you all on board. Coming back to some questions, do you think that these respiratory conditions are more worse in patients who are overweight or obese? And do you think that we should start screening everybody who is in a higher BMI and try to take interventions to put them on a weight program to probably try to improve their medical comorbidities?
I would say yes, because obesity not only links to respiratory condition that we are discussing now.
Right.
It has also linked to increased risk of other chronic condition, and all these are interrelated. For example, we talk about OSA. People with OSA are also at high risk of metabolic conditions. So if you treat the problem, for example, the obesity, you could reduce, the risk of them developing this problem,
yes.
and other conditions are also within control as well.
Okay. Hi Ivy. Thanks, Min Farhanim has said there's a nice topic today. Okay, another thing. Do we have any particular concerns for obese patients who are probably going to go for surgery? Is that more of a higher risk, or what do you think this group of patients should be concerned about if they're going for, let's say, a simple appendix surgery?
Okay, when you talk about risk of surgery, we are talking about the risk of the procedure itself. And when you were to discuss about obesity and the risk, we're talking about the risk of anesthesia. Because if the patients are going for general anesthesia, the obese patient, what happens, in a condition when you give induction of anesthesia, there will be a reduction in the functional residual capacity. So if the patient has undiagnosed respiratory condition, for example, OSA, if they are not screened properly and they are not given any intervention pre-operatively, of course that will increase risk of perioperative complication and post-op morbidity. So our anesthetist, like Mr. Kiru is a surgeon, so each time when we do a pre-op assessment, we will look at the patient's appearance, the neck, Malampati score, we look at the airway, because these are the things that actually give us some idea, how good are you in dealing with the airway when you are giving the anesthesia during the surgery.
Right.
So people with OSA, if they have symptoms, it should be tackled. This problem. For example, those with severe symptoms, sometimes we need to do polysomnography to confirm, or
Correct.
we need to consider pre-operative to give continuous positive airway pressure treatment, and to be more vigilant in the post-op management.
Right.
Some of these patients, they may end up having problem, especially when given anesthetic agents.
Correct.
Yeah.
That's right.
Yeah.
So I think, like even for obstructive sleep apnea, certain patients probably would, as we know, probably will benefit from a CPAP machine.
Yes.
So maybe a lot of our viewers don't know what is this positive pressure ventilation and what is a CPAP machine that they can use, and probably that will be helpful for them during surgery. Maybe you can have a word on that.
Just now we have mentioned about OSA, how do we diagnose? Okay, so the problem with OSA is the collapse of the airway during sleep.
Yes.
So the way to reverse this condition, one of the established treatment for OSA is what we call a CPAP machine, continuous positive airway pressure.
Yes.
So what this machine does is it generates a pressure in order to help your airway to maintain, open the airway. So that will actually eliminate the snoring and also the apnea episode. So this is to reverse whatever that's happened during sleep, the collapsible airway. So you keep it patent, so the patient will not go into apnea. So this is sort of the theory behind it.
I see.
To make it simple.
Yes.
Yeah.
So if let's say a patient that you have seen probably has a very high during a sleep study, a very high apnea hypopnea index. They look at the index to see, and if it's quite high, then probably you will prescribe them to be on a CPAP machine.
So I mean, if a person, we're talking about patient going for surgery. So of course we have to see what is the urgency of the operation. If this is a very urgent operation, you have to take a high risk consent. You have to do whatever your best to prepare the patient for the operation. But we're talking about the not so urgent operation or elective surgery. So you really want to have to make sure that patients are in a good condition before you go for surgery. So certain consideration, if let's say if the risk of going for GA is rather high, so the physician should discuss with the surgeon whether we should do this in
whether there's any urgency,
or local sedation sometimes, and you need to discuss with the anesthetist of how are you going to carry out this thing. You try to reduce, not to use too much of anesthetic agent or cut down the operating. Plan your procedure time. So this is a multidisciplinary. Sleep medicine is actually multidisciplinary. That's why we are here. We have surgeons, we have physicians here to manage the patients.
That's why I feel very reassured when we have any surgical cases, very high risk cases. We have capable respiratory physicians as well as anesthetists to help us manage together. And Dr. Ong, another thing, if let's say patients are prescribed a CPAP machine and everything, will they be readily accessible in using this machine at home? Can they rent it or do they need to buy it, and how much does the machine cost?
Okay, this machine is quite readily available. It's just a portable machine. Okay, you can either rent it or you can buy it. Of course, like machine is just like a handphone. You have different models. The CPAP machine that we are using nowadays are mainly auto PAP. Means we have the manual CPAP machine that we need to actually fix the pressure, at a certain range. On auto PAP, as the words explain, this is that we set in a certain range, and it actually changes, each time when the patient wear the CPAP machine and really sleep. So you can actually take this with you, even though you're traveling, overseas. So this is something that is not a big machine or something like that. It's quite a handy machine already. The price will range from, of course, we are talking about OSA. Of course, there are other more complicated sleep conditions, complex sleep apnea. We're not going to discuss here, but the normal CPAP machine, the price would be around 6,000 to 8,000. The machine, of course, the interface would have to be changed 6 to 12 monthly.
So it's quite pricey as well.
But of course you have a slightly cheaper one. Depends on what kind of machine you're getting.
Okay. So welcome Robbie Gohan. Nice to have you, and Sharon Coy as well. Welcome. So we are fortunate to have Dr. Ong, respiratory physician, with us today. Perhaps viewers, if you all have any questions that you'd like to ask Dr. Ong, I'll be able to read out your questions for her to address. Another very common thing, Dr. Ong, a lot of our viewers, are probably smokers, and many of them have tried to stop smoking. And I think the more deadly combination if you're an obese patient and you're also a smoker. So what's the issue on smoking and respiratory diseases?
I would say even you're not obese, you shouldn't smoke. Okay. Smoking, as we know, this is one of the major risk factors, established risk factors that leads to a lot of chronic respiratory illnesses, like people who are smoking. Asthmatic who smokes tends to do worse than non-smokers. Smoking can lead to a lot of cigarette-related lung diseases like chronic obstructive pulmonary disease. And of course, if you smoke, what happens in the airway? It tends to have a lot of mucus secretions and cough. We're talking about what happens in the airway if someone smokes.
Yes.
And if you already have the underlying lung condition, if you smoke, that's of course will make the thing worse.
Okay.
So yeah. So smoking is not
advisable. I think
we should try to get people to stop smoking.
Correct. I think we already know smoking is associated with more than 20, 30 different types of known diseases that we know of.
Not only lung problems.
Yes. So I think that's a really important point. And another thing, if for patients who are undergoing anesthesia, who are going for surgery, why is smoking advised in these patients to be withheld or to be stopped before surgery? Is there any particular reason?
I think it has got to do like what I mentioned just now.
Yeah.
Smokers who smoke, they tend to have a lot of inflammations going on, mucus production, and of course, these symptoms, the condition in the airway, of course, will actually affect one's a function, pre-op and post-op.
Yes.
For example, post-operatively, if one intubated or extubated for surgery, post-surgery you have pain, you tend not be able to breathe well. Even coughing would be a lot of effort for someone, especially if there's a surgery involving the thoracic cavity or even the abdomen surgery. So smokers, if they smoke heavily, of course they would actually have higher risk of getting the mucus or the secretion out from it, and more chances of lung atelectasis, collapse post-operatively, and that will lead to infection. Okay. So a lot of time people after surgery, we always want to get them to move about quickly, get them out of bed, and chest physical therapy is one of the important things in the post-op care.
Correct. Yeah. So I think the take-home message is that even for patients who are going for surgery, I think the first thing, try to stop smoking, especially if you're planning to go for a procedure that is involving the respiratory system. Of course, stopping smoking anytime is a good thing.
Yes.
And the second thing is that if you are obese and you have multiple comorbids, then you have to be checked up by the physician as well as anesthetist to evaluate your risk for going for a surgical procedure, right? Okay. Coming to this segment, Dr. Ong, normally we have a segment called From the Kitchen.
Okay.
So unfortunately today we don't have anything prepared from them. But what we do have is a recipe. I think most of our viewers now, because of the movement restriction order, everyone's at home and frequently feeling kind of bored. Probably one because of the isolation. There's not enough of activity, so a lot of them are feeling probably a bit bored at home. Not much chance for you to go out and exercise and so on. And also, probably you want to go to your favorite place to eat. You won't have that opportunity as well, right? So what we have here is a preparation from our kitchen. It's a fried vermicelli with vegetable spring rolls, which we will share with our viewers. We will put it up in our Facebook page. And basically, it's a preparation that you can actually use. It's actually made from brown rice vermicelli, and it's basically very healthy. And it's a twist from the old tradition to increase and for additional fiber intake. So one serving of our fried vermicelli with vegetable spring rolls is with chicken. It's about 65 calories, containing only about 4 grams of fat and about 7 grams of protein. And if you take fish, it's about 35 calories and 7 grams of protein. So please look up.
Can try this out.
Yeah, you can try it out actually, and probably can share it with your family and cook with them at home. And another kind of a dessert, or it's overnight oats. You can actually have it for breakfast, or you can actually have it for a kind of a snack. So we will have this as well on our Facebook page, and this is actually for those who do not like to eat oats. Okay, so you can try this overnight oats. It looks kind of nice from the picture that we'll put up later. And basically oats is very rich in fiber, carbohydrates, and if you're using plant-based proteins like soy protein and so on, it's even more enriched. It's a powerful meal for your gut, for your heart, and of course for your brain health. And you can add in the fiber by adding in fruits like bananas, berries, apples, and grapes, and so on. It's good for those of you who are vegetarian, who are vegans. You can actually use plant-based milk. You can make it sugar-free by adding in sweeteners, or you can even remove the sugar, and you can actually use fruit-based fructose. So you can actually use mashed banana or grapes and so on. And you can even use it, make it gluten-free by using gluten-free oats. So we will share all these recipes on our Facebook page. Kindly please have a look, and feel free to share it with your friends and relatives. So coming back to our situation, how, Dr. Ong, would you advise our patients? Before that, I think I'll take a question.
Okay.
Yeah, we have our regular viewer, Ms. Farhanim. Doctor, can stress the causes for OSA? What are the causes that, besides obesity, that can probably contribute to OSA? Or
there are certain conditions that will actually lead to OSA. Of course, obesity is one of it. The other things, remember I mentioned about the Asians and the Caucasians, the difference. Our facial structures, sometimes with structural abnormalities are other conditions like, especially in pediatric group, if they have large tonsils or adenoid, all this is something that obstruct the airway, abnormality or structural problems like deviated nasal septums or things like that may actually contribute to the symptoms. But in majority of cases that we see, obesity is still one of the main reasons. Okay, and of course, if someone with increased body weight with this structural problem like receding chin, of course that would increase the risk of OSA.
As well.
Yeah. So what happens is actually that leads to the collapsible airway during sleep. So that is the main problem of OSA.
I see.
Yeah.
I see.
Mm-hmm.
So, Dr. Ong, if for majority of your overweight and obese patients, right, so how would you manage them? Would you also address the treatment option in terms of weight reduction for these patients as well?
Yes, I will. If I see your OSA patients, I will go through with them. It's never easy to do, especially to advocate, weight reduction.
Yes.
So, as I say, this is a multidisciplinary approach. First, you diagnose a condition, and if there are other risk factors or other aspects that you can modify, for example, weight reduction, definitely is going to be helpful. So, any percentage of weight reduction would definitely improve the condition. Even if they're on CPAP, they probably don't need a higher pressure. They will feel generally better, and that will also take care of other comorbid conditions. If they have hypertension or diabetes, that would also be helpful.
Yes.
So yes, I will. I do refer my patients to dietitian. Like if I have a suitable patients, really obese patients with OSA, I would even consider whether other options like weight reduction, not only in terms of the diet, but some patients might need to go for certain intervention. That's something that we will consider and I will consider.
Correct.
Yes.
Because nowadays, as we know, we have a lot of options in terms of weight reductions, from meal replacement therapies, referring to dietitian, aggressive or what do you call it, tailored
Yes.
Exercise regime or fitness program for individuals, medications for weight loss, the intragastric balloon, and even bariatric surgery. So the good thing is that in our season, as the topics grow on every week, we will be addressing every different types of interventions in the weeks to come by. And at the moment, I think we've covered quite a bit of things as well. And if our patients who are obese and they are preparing to go for, let's say, interventions that are more which are more invasive, let's say like surgery and so on, as a respiratory physician, how will you prepare these patients for surgery?
Like I said, depends on the severity of the OSA. You need to actually treat the OSA first. So this is actually to reduce. We're trying to reduce the perioperative and post risk and post-op morbidity. So I would actually work closely with the surgeons. The plan, the time. So to make sure they are okay and they are compliant on the CPAP treatment, and most of them would actually on CPAP treatment. And not to forget about nutritional aspect, and also the exercise, before the surgery, like what we do for all the surgical patients.
Yes.
Get them to do breathing exercise, and all this will definitely be helpful because the lung, you just imagine, they're already obstruction, you need to actually improve other aspects, the mechanical aspect of the lung, the lung expansion. These are very important, especially if we talk about post-op care.
I see, yes,
yes.
I think as we know, health is wealth, and I think a lot of us are being made to face reality at COVID-19 situation where we're all at home, and and we have a point in our lives where we actually valuing the freedom that we had before this, and how important health is, and how it can be just taken away just like that. So I think a lot of us currently realize that I think it's very important for us to take care, and once we are out of this situation, maybe we should actually invest some time in good eating habits, diet, exercise, and so on as well. So regarding the current COVID situation, so Dr. Ong, I think our DG had mentioned about regarding wearing a mask and so on. As a respiratory physician, maybe there's something that you'd like to share with our viewers as well regarding that?
Yeah, I think nowadays it's quite difficult to get a mask. We working in the hospital. Of course, if you guys are staying at home, you're not going into a crowded public area, that's probably not really, you don't really need to wear a mask. Of course, if you are going out to, get food or whatever, if you're going to the public places, remember, not only the mask, remember social distancing, hand washing, you don't simply touch on the area and touch on your face. These are the measures that we always have to remember, okay? So coming to a place where, like in the hospital, of course, if you are falling sick, of course you need to wear a mask. But healthy people, if you are not going anywhere, it's probably not really needed to wear a mask at home.
Yes, I think
just have to use it judiciously.
Correct. I think we shouldn't panic, and everybody wearing masks.
Stay at home, stay safe.
Exactly.
And hand washing, social distancing. I think this is very important.
Yes, excellent. Okay, Dr. Ong, I think we've come to the end of the show. Maybe is there anything probably you want to share with the viewers aside from what we have said? I think so we can wrap up.
So I wish every one of you, at this very crucial moment, try to do our part, okay? We stay here to work, okay? And you guys stay at home and stay safe. Yes. And I think we can do our part, okay? Yeah.
I think excellent, Dr. Ong. I think I totally agree with that. I think on this note, I think we will end our this week's program here. We are doing our best as frontliners in the health infrastructure for the country, and to all our doctors and colleagues who are working in the front lines in all over Malaysia, you guys are doing an excellent job, and we are with you, and I'm sure our public appreciates the hard work that you guys are putting out for them. And let's pray hard that we come out from this very difficult situation together and stronger, and have a great week ahead, and let's hope and pray that situation improves. With that, thank you very much. Thank you, Doctor.